The world is undergoing a unique new coronavirus threat. Since its existence, several hundreds of people get affected, and many die every day. Let us unite to battle against the virus by protecting ourselves and preventing it from spreading further. The new coronavirus disease 2019 is called as COVID-19. The COVID-19 disease can spread when a person coughs out droplets from the nose or mouth. People near to them can catch virus if they breathe in these droplets, or if they touch eye, nose, and mouth after touching the virus strains that survive on the object or surface where the tiny droplets landed. Coronavirus spreads rapidly due to these possible transmission classifications. When an affected person travels to the non-affected area, then it is called an imported case. If the person starts spreading the disease with family and those contacts around them, it is called local transmission. And when people begin to contract the disease in large area without a clear source, it's called community transmission. Once a person is infected, symptoms start to develop about 2 to 14 days later, and this period is called the incubation period. During the incubation period, symptoms rarely show up. The infected person starts to spread the disease to others without even knowing that they carry the virus. COVID-19 virus-infected person may have symptoms like high fever, dry cough and shortness of breath. The highest risk is among the elderly and those with other serious health conditions. Unfortunately, there is no vaccine or medicine currently available against this virus. In the meantime, the best strategy is to protect and prevent it from spreading this disease. Here is how you could protect yourselves. Wash your hands as soon as you get home. Always keep your hands clean by washing your hands regularly with soap and scrubbing your hands thoroughly for 20 seconds. Keep an alcohol-based hand sanitizer handy for times when soap and water are not available. Avoid touching your eyes, nose and mouth with unclean hands. This is a common entry point for viruses into the body. If you go out, keep your distance of at least 2 meters or 6 feet away from other people at all times. This is otherwise called as social distancing. Sterilizing frequently touched surfaces like keyboards, phones, taps, toilet seats, and door handles. When you would like to greet someone, instead of handshake, prefer namaste or hand waving. You could protect your loved ones being affected by the disease by practicing these simple precautions. Always cover your mouth and nose when you cough. Use a kerchief or tissue and dispose it properly into a closed bin immediately. Don't cough or sneeze into your hands, instead use inner side of your elbow. Don't travel or visit crowded places if you are sick. Do wear a mask if you are sick, and also if you are taking care of someone with the symptoms. You could also contribute to protect your community by self-isolation from others and stay indoors if you have a fever, cough, or difficulty breathing. In any case, call your healthcare professionals and follow their advice. To stay with current updates on COVID-19, watch out your government and WHO website regularly. Due to alarmingly raising affected cases and death, most of the countries across the world enforced lockdown of all its provinces to prevent it from further spreading. Follow your government instructions and guidelines diligently. Do not step out of home unless it is an emergency and only if you need any essential things for your daily living. Practice precaution to protect yourself and prevent COVID-19 virus from spreading to your loved ones and of course your society. Do not panic. Stay safe.